Good evening. I would now like to call to order our meeting today for the Allegany County Board of Education, Tuesday, September 14th at 5 p.m. At this time, please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Brooklyn Noel, our student member of the board, was not able to attend this evening, so we want to welcome her alternate, Genevieve Batman, who is over here to the right of Dr. Bond. Thank you for joining us this evening. We have the consent agenda. First on our agenda this evening, is there a motion to approve the consent agenda as read? Motion by Mr. Farrell, second. Second by Ms. Frank. All those in favor? Motion passes unanimously. Thank you. Our superintendent's report, I will turn it over to Mr. Blank.
Good afternoon. At this time, I'd like to call on Janelle Mayer, our health officer. She's going to give us a vaccine update and take questions from the board. Welcome, Janelle.
Hello. As Mr. Blank said, I'm Janelle Mayer. I'm the health officer at Allegany County Health Department. And I wanted to give an update on our data in the county and also answer any questions you had about isolation and quarantine. I know more questions are coming up as the school year goes on. So I handed out a piece of paper to the board members that has the data as of today. So our COVID case rate as of today is 68.77 cases per 100,000 population. And that's compared to the Maryland COVID case rate of 18.63 cases per 100,000 population. So you can see we're above 3 times the state rate as of right now in Allegany County. Our percent positivity is 12.54%, and the Maryland percent positivity is 4.61%. And what that data means is of all of the tests that go in for Allegany County residents, what percent come back positive? So 12.5% are coming back positive for Allegany County residents, but Maryland residents as a whole, it's only 4.6%. When we met last time, we were talking about the COVID transmission categories on that CDC map, and we continue to be in the high category for community transmission. Our percent of our population that are fully vaccinated, we are at 43.28% in Allegany County. And in Maryland, that number is 63.03%. So again, still below where we are in the state as a whole. Among Allegany County teens, ages 12 to 17, 26.9% of us are fully vaccinated, not us, them are fully vaccinated. And in Maryland, that number is 58.6%. And if we look at teens who've had at least 1 dose of COVID vaccine, we're at 33.1%. compared to 69.5% in Maryland. I did want to just tell you a little bit about the isolation and quarantine guidance. So when the health department provides guidance, we are using 2 resources. One is the CDC quarantine and isolation guidance. And then the other is the state of Maryland put out, Maryland Department of Health in conjunction with the Maryland State Department of Education put out pre-K through 12 school and child care COVID-19 guidance, and we use that document as well. And that's being used across the state of Maryland, and that's how decision making is happening. So does anybody have any questions about quarantine, isolation, different scenarios?
Mrs. Fraley.
So I have a scenario question.
Okay.
So a scenario question is, since we have the mask mandate in our schools right now, all the children are wearing masks. If you have, inside the school, all children are wearing masks. If you have somebody that tests positive, that's a student in the classroom, as you showed us in the graph last time, the students around them do not have to quarantine unless they show symptoms because they're wearing a mask. But a scenario, just so everyone's aware, is if that student that tested positive goes home and has either parents or other students, which is the real question, if they have other students in their home what's the quarantine procedures for those other students that are their siblings, basically?
Their siblings would have to quarantine. So you have the case, they need to isolate for 10 days until they're better. And then what you're talking about is the exception for a K through 12 indoor classroom setting. If everyone's masked and they're in the 3 to 6 foot range, those around the infected student do not have to quarantine. But if they go home and they're spending time with their sibling in their home, obviously there's exposure there and the sibling would need to do a full quarantine.
And just to clarify too, the quarantine of that sibling, this came up on the state board meeting today, or the state committee meeting today. That sibling, when does their quarantine period start? Is it start 10 days after the positive person's complete? So it's like 10 plus 10?
It starts at their last exposure. So in some cases, let's say you have an older student and that individual can isolate in their own room with their own bathroom. They're 17 years old and they'll be okay. Then the other sibling can start their quarantine. If they're continually exposing the sibling, then the sibling can't start their quarantine until the case is out of their isolation period.
Just to say it out loud to clarify, because I've had this question asked multiple times, then it really is, it's 10 days after your last exposure, which in most cases in a household, you're exposed unless you're older or have more than one bathroom. And I think that was one of the big things I've heard is, I only have one bathroom. So in reality, if you only have one bathroom, you're constantly exposed because you're using the same bathroom. Even if they're in separate bedrooms, you're using the same bathroom. So that would mean that sibling would start their isolation period after the isolation period of the positive person. So that could be 10 plus 10.
That's right. Right. And then, of course, with younger children, you're not going to leave a 5-year-old alone. So then there's always, the situations can get complicated when you have siblings, multiple parents, depending on who's positive and what their exposure is to others in the household.
Mrs. Frank?
Thank you for coming today, because I know that all of us have had multiple questions from people in the community. Could you readdress the situation on a bus and who's quarantined, if all the children on the bus are wearing masks? I know that we're crowded on some of these buses, and so could you give some idea of how that process happens, or who has to quarantine then?
Okay, sure. So let me just start with the regular definition of who has to quarantine. And this is in every scenario outside of school. If you're within 6 feet for 15 minutes of a case, then you need to quarantine, and you're not vaccinated. And then you get into the exception that CDC added for kids in a school setting. That exception only applies to students in an indoor classroom. Everybody's masked. They're sitting in the 3 to 6 foot range. And other precautions are in place, like social distancing, masking, cleaning surfaces, those things that we know are existing in our schools. That is the only case where that exception, less than that 3 to 6 foot range, applies. So if you are talking about 2 kids at a birthday party and they had masks on, or 2 kids at home or on a bus, that exception does not apply. So if you have 2 children who are unvaccinated sitting next to each other on a bus, even if they are both masked, one is positive, the other is not, the one who is not does need to quarantine.
Follow up on that then, because with this 6 foot distance, you're talking about the row of students, the students across the aisle, 1 and 2 rows ahead of them and 1 and 2 rows behind them.
So
If there's a positive case on a bus?
a 6 foot circle around the case. And then if you are talking about that inside a classroom in that 3 to 6 foot range, you're imagining a 3 foot circle. So it doesn't matter if this person is behind me, if they're within 6 feet, that counts.
Okay.
It doesn't matter which way you're facing.
Oh, I'm sorry. There were a lot of questions about transportation in particular, because I think in the classroom settings, it's more manageable and controllable. And there were some concerns about overreaching quarantines, but there were also concerns about underreaching quarantines. Parents who thought their child should be, based on where they were sitting on the bus. So it's a learning experience for all of us to continue with this. Thank you.
Right. In a classroom, like you said, it's a more controlled setting because you have the ability to set up the desks, but keeping a 6-foot distance on a bus is not possible if you have more than 4 kids on the bus. So you're just doing the best you can. And then we, of course, recommend keeping windows open, keeping airflow going, trying to minimize crowding as best you can.
The CDC allows for shortened quarantine after day 7 if you've received a negative test after day 5 or later of exposure. I understand that's not allowed for the students to shorten a quarantine, and can you speak as to why, please?
Sure. So per CDC guidance, there are 3 options when it comes to quarantine. So remember, this is not somebody who's positive. This is somebody who's a close contact to a case. So the first option is a 14-day quarantine, and that's the safest option. The second option is a 10-day quarantine, slightly less safe, so slightly higher risk that they would transmit to others when they come off their quarantine. And then the third option is they test at day 5, get a negative test, and they complete their quarantine at day 7. And that is slightly more risky. So we, at the health department, when we're looking at cases, when people are going back to a high-risk setting, childcare, schools, any sort of congregate living facility, we do not allow for that third shortened quarantine option, which is the 5-day test, get out after day 7.
Anyone else have questions for Janelle? Mr. Blank?
Janelle, could you clarify for us, as we're going through a contact tracing, there are a number of questions about our students who are vaccinated, and that we are not treating kids equally when we're going through that. And what we're sharing with those parents, it doesn't have anything to do with, all it has to do with is whether they're vaccinated or not. So could you share with us, when you do the contact tracing, what we do with students and or employees who are vaccinated?
Sure. So vaccination, we all know, offers this level of protection. And one of the benefits of getting vaccinated is that you do not have to do a quarantine if you're in close contact to a case. And that's not just in the school world, it is in the whole world. So every case that we're looking and doing contact tracing, if I'm fully vaccinated, so if I'm in close contact with a case, I do not need to quarantine. I can continue my daily activities. I would wear a mask just to be sure. And now CDC has added that because of the Delta variant, they do recommend that somebody who's fully vaccinated and a contact, that they test at day 3 to 5, and then just take extra precautions paying attention to symptoms and things, but they do not need to quarantine at home. So it's no sort of bias for a vaccinated student versus an unvaccinated student. It's just the fact that the vaccinated student has a level of protection that an unvaccinated student does not have.
Thank you. I do have one other follow-up. The terminology that we're using, the outbreak, when we have an outbreak within a classroom,
Right.
That term seems to have a lot of our community thinking something differently than what it is. We've been, as we put our information out, we try to explain what that is. So rather than me going through it about the 2 or more, could you just summarize real quick what a classroom, what warrants a classroom outbreak when we have to report it that way? Sure.
So a classroom outbreak is 2 cases in a classroom who do not live in the same household. So you're right, the word outbreak is a heavy word, but it would meet the definition of a classroom outbreak if you had 2 kids, not from the same household, who are both positive in the same class.
In my last statement for you is, as you're doing the contact tracing specifically with our schools, the message that I'm hearing is to remind everyone, if you have any symptom on our list, not to come to school, because that's one of the things that is causing so many different quarantines had we not sent somebody. Is that accurate to say from what you're seeing from the health department side?
Yes, I mean, I think that's true of any illness. If your child is not feeling well, you should not send them to school. And I just want to put a little plug in that we still are offering free testing every Monday, Wednesday, and Friday out at the fairgrounds. You don't need an insurance card. You can just drive up. It's free. And I think that's a really important resource to have if you have a child who has a sore throat and a headache and you want to know. That is available, and it's at no cost to anyone.
Thank you.
Ms. Fraley?
So on your example of an outbreak, does that change the quarantine procedures at all, or is it just a designation?
It is just a designation.
Including if it's a school outbreak, same concept, right? There's classroom outbreaks and then there's school outbreaks, which is more than some other definition. So a school outbreak.
I actually want to correct this because last time I told you the wrong thing. So a classroom outbreak is 2 cases in a classroom. A school-wide outbreak is 3 outbreaks, so 3 cohorts. So you have, let's say, a 2nd grade class, a 5th grade class, and a 3rd grade class. Then that would be considered a school-wide outbreak. Last time I told you 2, and I'm sorry, I got that crossed in my mind, but it's actually 3 cohorts.
And same difference, though, if there's a school-wide outbreak, the quarantine process, it's just a designation of the number that's occurring in that school.
Right. There's reporting that goes on to the state of Maryland if there is an outbreak in a classroom or an outbreak in a school. It does not change the quarantining needed for students or staff.
One more.
Let me piggyback on it. So if we have students at a birthday party over the weekend, and then they come to school on Monday and they test positive because they were there together, we would call that a classroom outbreak. So that definition doesn't necessarily mean it happened at school. It means there's 2 people, two or more in the classroom. Is that
That's correct. Yeah.
So after testing positive, how many days back is contact tracing? So if I'm on a Monday, I test positive on a Monday, you go back how many days to say that these people together?
So when we do contact tracing, we're looking at symptom onset. So as soon as somebody starts with symptoms, we look back 48 hours and we say, who were they with? How close were they? What was their level of contact? And those are the individuals that are needing to quarantine. If someone tests positive and they have no symptoms, then we look back 48 hours from the test.
Mr. Carroll?
I just have a couple comments. I do appreciate you coming and the way you've worked with the board to try to make everything work smoothly through this pandemic and through what we're going through is admirable, and I want to commend the health department for that. I did get vaccinated, and that was my choice because of some issues, and I did take you up on your testing at the fairgrounds here a while ago, and to my chagrin, it came back positive. But I think that probably my symptoms were lessened because of that. The only comment I have is that it seems like it takes quite a while. I think for me it was like 5 days to get the result back because it went through a weekend. If there was some way to shorten that, maybe folks would do better with that. But I can say that the wait time was very minor compared to other places. I know I called the Urgent Express in LaVale, and I went and got tested because I'd been around somebody and I knew it that had it, but their wait time was like 5 hours. My wait time at the fairgrounds was 3 minutes, and they did a very good job, and they were very nice, and the folks that contacted me after that were very nice. So I do commend you for that, but I wish that because of that 5 days, that could somehow be shortened a little bit, because you might have people who go get tested and then they don't have an answer, so they just go on about their own business, and they could be, spreading the virus. So thank you very much.
Sure. I hate to hear that it was 5 days because we always are aiming for 2 days or less to get a result back. And we do, I don't know when you went, but we do have, our lab currently has an online portal so people can log in and see their result faster. So I hope now if somebody went, it would not be 5 days.
I hope so too, and that was my only reason for bringing it up. I went through that card they gave me in the portal and finally sent them an email and, whatever, but I do urge people to try to do that, and maybe since the numbers are going up, maybe you want to think about just a suggestion from me to increase the time or something so that folks could, be able to go there more often. Because I do know that we've had students, the parents have known that they possibly were sick and they sent them to school. And then we end up, you and us, end up dealing with the after effect of that. And that's tough, where the people are doing the right stuff, and then somebody chooses to not pay attention to what you're supposed to do and send their kids, and then everybody else has to deal with it. So I thank you very much.
Ms. Batman.
Hello. I would just like to clarify what constitutes a quarantine. So you previously mentioned that masked students that are adequately physically distanced and masked don't need to necessarily quarantine if they came in close contact with a verified case. So can you explain what specifically separates the quarantine procedures? Like, for example, if an unvaccinated student is masked and distanced from a verified positive case, must they quarantine even if they're at a neighboring desk? Does a desk away, does that mean that you are adequately distanced?
Okay, I want to make sure I understand your question. So it sounds like there's actually a couple of questions in there. So a fully vaccinated student who is, let's say, sitting right next to a case does not need to quarantine because they are fully vaccinated. So that person is out. Not out of school. They do not have to quarantine. Okay, and then when you're talking about spacing in a classroom, there's a very specific exception for an indoor classroom setting, K through 12, that the CDC has added, which is both students have a mask on their face. You're in the 3 to 6 foot range, which is about the distance between desks in a regular classroom. And then you have other precautions in place. Then those students would not need to quarantine.
Okay.
But just like others mentioned, if they, then they went to a birthday party and they had no mask on, or they're outside of that setting in school, which is a very controlled setting with the spacing of the desks, then that no longer applies. It's only in the indoor classroom setting.
Understood. Thank you.
Okay, thanks.
Ms. Fraley.
And just to go on that, the outdoor activities, extracurricular activities of any sort, are outside of the school building. So it goes back to your original standard 6 foot apart, masked or not masked. A lot of times outside activities, they aren't masked, but sometimes they are. Regardless, it's 6 feet. It's not that 3 to 6 feet. Even though it's a school extracurricular activity, it's outside. So it's 6 feet apart, or you have to quarantine.
Correct. 6 feet, 15 minutes outside of the classroom.
Ms. Frank.
Just one more clarification, because I think you've said it, but I think a lot of people aren't hearing it. If I'm sitting next to somebody, I have a mask on, they have a mask on, I'm vaccinated, they end up positive, I don't quarantine.
Correct.
Even if I'm not vaccinated, as long as I have my mask on and we're 3 to 6 feet apart, I don't quarantine either.
Correct.
I just want the public to hear that, because these are keeping kids from being quarantined by the hundreds and hundreds.
Yes.
Because it doesn't matter then if Tammy's vaccinated or not, or you are if you're standing right next to me. I don't have to quarantine because I have a mask on,
Right.
even without a vaccination.
Correct.
Okay, I just wanted to make sure that was repeated.
Mm-hmm.
Thank you.
Are there any other questions for Ms. Mayer? Good.
Okay, thank you.
Thank you for joining us. Mr. Blank is going to provide an opening on our school year,
Thank you,
an
Janelle.
update to the opening of our school year.
Yes, ACPS returned to school on August 25th. We have approximately 8,000 students receiving in-person instruction. Staff and students have overwhelmingly shared their excitement about being back in school. I want to take a moment to thank the county emergency team for assisting ACPS in making a decision to close on September 1st due to heavy rains and flooding. Mr. Roger Bennett communicated with our transportation supervisor, Mr. Mark Morrill, throughout the effects of the hurricane. These are very difficult decisions. It's easy to say it afterwards, but during it was very difficult to work our way through that, and we appreciate their support. Each classroom has an air purifier, which I discussed at our last board meeting. And I want to recognize Supervisor Mr. Wally High and his operations department for distributing and setting up the air purifiers immediately. Our CFO, Mr. Larry McKenzie, worked on making sure their air purifiers were ordered and delivered as soon as possible, so thank you. I have an air purifier sitting here. I brought one over so that everybody could see what we're talking about. The air purifiers have 4 speeds on them. They have a timer on them. They're not just a little thing that sits in a corner. You can see the size of it, and it has a HEPA filters. So as when our instructors get to their classroom, they can put that on and hit the timer, and it will automatically shut off. Whether they set it for 2, 4, 6, or 8 hours, it'll stop. The speeds on it are 1 through 4. Some classrooms, if it's a small classroom, it may be a little too loud, so they can bump that down. If not, they can have it on 4. So that's what's going on in every classroom as we speak. Our school day is as normal as possible. An exception is social distancing at lunch, which requires students to be 6 feet apart due to having to take their mask off. Other extracurricular activities started in early August and have been moving forward as permitted with COVID rules. We knew coming into this year that disruptions would and will continue. However, events have been and will continue when permitted. ACPS is back to school. To our employees, thank you for all that you're doing so that our students can have a successful year in returning. And we'll work day to day throughout this pandemic to see as we can get as much instruction, as much extracurricular activities to take place for our students as possible. Whatever COVID will permit us to do, that's what we'll be doing. So thank you. I'll take any questions.
Mrs. Fraley.
Based on the fact that you said we have 8,000 or so students that are in the classrooms when we started the school year, I know that the last update from the communication office was that there was 300 and some number of students that were impacted as of last week. And I know that we get those numbers every week. I mean, I'm assuming it's not cumulative. So the first week was 200 and something, and the next week was 300 and something, which some of those kids may be the same, but not always, right?
Right.
So with that being said, I think that, what is the school system doing to ensure that those kids that are having to quarantine for whatever reason have adequate access to their ability to be educated? And in my case, the reason why I'm bringing that up is I have a son who is in 10th grade. He only missed 1 day, and it really had nothing to do with COVID, but he missed a day, and he was unable to even understand his assignment, and that was only missing 1 day. So I think that, we need to look at that if we can, if we haven't already, and if we need to discuss it under new business, we can do that, but I think we need to look at that.
Sure, I can respond to that. We have implemented, we've just started, we've been at school for 12 and a half days, okay? We had a day of rain, and the first day was a half a day, so that's how much we have under our belt at this point. When we brought our plan, when Dr. Caldwell and we went through our plan, which everybody voted on, everybody understood, when we voted on it, that if we're in quarantine at this point in time, that we would have packets or we would use Schoology to make sure that the students got their assignment. So if I'm quarantined for 10 days, when we were talking about this plan, when you're quarantined for 10 days, that means you're missing 6 days of school, because no matter how you slice it, you have at least a Saturday and 2 Saturdays and Sundays within that time frame. And when we have a day off, it's less than that. So the maximum number of days under a regular 10-day quarantine, I know there can be more than that, but on a regular one, it's 6 days of school. So what we shared with the board was that we would continue to do packets, and in the meantime, try to build on that. And at this point in time, we're working on, as you know, that we shared our tutoring program, and we're trying to implement that within our students who are quarantined. So if I have homework or I have assignments, we're hoping, as we're working through this, again, this is new to everybody, including us. So bear with us as we're working through it to try to make sure everyone gets as much instruction as possible. When they contact the school's trying to set them up so that they have questions with that specific subject, that we'll be able to get a tutor that will be able to help them during that point in time. Elementary, obviously, is completely different than the secondary. Secondary, you have to have people who are certified in certain areas as opposed to just elementary. So it's a little more difficult task for our secondary to take. But that's what they're working on as we speak. When the board voted on the plan, that's what we were deciding to do. That's what we moved forward with, because we want students back face-to-face. The option of students not being back face-to-face, as we saw in the spring, a number of the a number of the voices that we heard here, they wanted their students back, and all of a sudden, 25% of our high school students were not back in school. You can verify, you know how many of your classmates were not. That's not our objective. Our objective is to have our students back in school as safe as possible. So those students who have a health condition, we have home and hospital. That's already taken care of. If there's an issue, we are taking care of that. They're not coming to school. We have somebody taking care of those students with instruction as you voted on with that plan. As we move forward, we'll be looking at any option that we can to help assist students when they're quarantined or any other situation. But we're learning as we move forward, and we're trying to make sure we make as many accommodations as possible. So it's not as simple as just, we're going to do this, and without working with all the parts to instruction. I can't just say, as you know, you all sat here when we were doing concurrent teaching. We know what kind of effect that has on staff. So we know what was going on when we were doing the hybrid. We had plenty of the community coming in, my child going twice a week. We know what they said when we were completely virtual. So there's not a solid answer for everyone, but we are working on things as we move forward. And one of those things will be focusing on students who are quarantined. Are there other things we can do after we see how the tutoring, how effective that is? So that's a short answer or a long answer, but there are a lot of questions that we still have, because that's how we're moving forward as we speak. So right now, we're sticking to the plan. It was approved, it was presented to the board, and we're moving forward. And it's a living document, so if we can change things to improve, obviously, we'll take a look at doing that. Yes?
I just wanted to add also, and I totally agree, we all voted on that plan. The numbers were dramatically different when we voted on that plan. The numbers were dramatically different when we surveyed parents about, would your child be more comfortable, or you have your child be more comfortable in a virtual setting. We sent that survey out in July, I believe, and asked parents, and the preponderance of evidence at that point was that a lot of elementary parents had concerns, but not middle and high school. I'm hearing from a lot of parents who would like to take that back. You know, these are elementary parents who in July, our numbers were low. They thought, no, I want my child back in school no matter what it takes. But now are very fearful when you look at the numbers that Janelle presented tonight, that just keep going up, and we're not getting any better with vaccination rates in this county and so on. And I think that they want the option to, even in the third week of school, to say, you know what, I've had enough and I'd like my child in the virtual school. We've not, to this point, allowed that possibility, because that's hard to plan for. We have to hire teachers to teach virtual classes, and there's limits and things like that. But I think as this living fluid document moves forward, we've got to have opportunities for these parents who feel paralyzed because a decision they made in July is impacting their child now. And I would go a step further to even say, maybe, you know, and you kind of alluded to this, at the secondary level, that needs to be a conversation also. These numbers are horrible. You know, in the worst of the worst last year, we were looking at numbers that were actually better than this. And I look at this and think, this is crazy. You know, so I would feel better, and you have said that, it's a fluid document, it will continue to be under review. But to the parents who've reached out to me, I want you to know that I've at least suggested that that's something we need to pay attention to, particularly at the elementary level, because they don't have the option of vaccination right now. Maybe they will in a month or two, but right now they don't. So that's all I wanted to add to the conversation.
Yeah, you're exactly correct. We have been treating the elementary virtual program just like we do an out-of-district program. At this point, we have approximately 111 students that are in our virtual program for our elementary students. We have shared, that number changes, so that may not be exact today. The reason it changes is because we're doing exactly what you just stated. Until those virtual classrooms are full, we are not turning anyone away. So at this point, from talking to Mr. McGowan and Dr. Caldwell, there are some that were in the virtual program and said, I didn't realize this is what I signed up for. I want my child to go to school. So we allowed them to go back. We also have some that said, I want my child to go into the virtual program. To my knowledge, at this point, there's not, from kindergarten through 6th grade, there's not a classroom that's full yet. So I don't know if anybody that we have denied. Now, we will deny when we get to that point, because to your point, once they're full, they're full. I don't have another option at this point until we can revisit. And it's not necessarily a money issue. It's making sure somebody's certified as teaching their children. So it's more about that. The numbers that you're referring to, right now we're approximately 92% of our students are not affected by COVID. So yes, we have 8,000 students. So when you talk about the number, that number is large. I'm not trying to paint a picture differently, but we do have 92% approximately. I don't know what today's numbers are, but cumulative. Our staff, I believe our staff, because our staff is 75 to 80% at a minimum, has had the vaccine. We only have about 2% of our staff that have been affected, whether it's quarantining or COVID. So that's clearly shows what's going on with our staff. So my point being, we can keep our staff, and that includes every employee, not just teachers. So that means that's how we can stay up and running, fortunately. That's why I'm referring to that. So with the elementary, we should still have those options. And the overall numbers, I'm going to defer. Janelle, tell me if I'm incorrect, but I thought at our peak, right now we're at 68%, which is extremely high, but I thought we were at 198 at one point. Am I accurate?
Our very worst day, beginning of December of 2020, was 198 cases per 100,000.
Okay.
Our very worst day.
And I didn't ask her that before. The numbers just stay here sometimes, and that's one of those. So I'm not downing the. I agree with you 100%. Our numbers are high, but at the same time, we'll see how this plays out and try our best to keep kids in school. So to your point, I'm glad you made that point so that people do know that our elementary options still are available.
Are there any other questions for Mr. Blank?
I'd like to make a motion to discuss under new business the options and the abilities for high school students, so that we can have the discussion, and it doesn't have to be solved today, but I think we need to have the discussion. So I make a motion to have new business discussion of 7th through 12th grade.
Motion by Mrs. Fraley. Is there a second?
I'll second the discussion.
Second by Ms. Frank. All those in favor? Opposed? Abstained? Motion passes. That's under new business. We will add it after the school calendar adjustment. Okay, moving into unfinished business, I will turn it over to Mr. Llewellyn for second readings of non-discrimination policies.
Board members, you have before you policy AC. This is your non-discrimination policy. This is a second reading for the change in this policy. It's a minor change. We're simply bringing this policy, the non-discrimination language in this policy, in line with the state's non-discrimination language. And if you pass it tonight, then it's final.
Motion to approve non-discrimination policy for second reading.
Is there a second? Second by Ms. Frank. Any discussion? All those in favor? Motion passes. Thank you.
Next, you have before you non-discrimination equal employment opportunity policy, GBA. This is the exact same thing. We're bringing our non-discrimination language in this policy in line with the state's current non-discrimination language.
Motion to approve policy GBA, non-discrimination equal employment opportunity for second reading.
Second? Second by Mrs. Frank. All those in favor? All those in favor? Motion passes unanimously. Thank you.
Sorry, I want to make sure I didn't get ahead of myself. Next, you have before you for second reading a brand-new policy, employee use of social media. This is policy GBDA, and this is a brand-new policy. We reviewed it last meeting. It's up for second reading.
Motion to approve employee use of social media policy GBDA for second reading.
Is there a second? Second by Dr. Bond. All those in favor? Motion passes unanimously. Thank you.
This is the last one on your agenda tonight. This is policy JB, the Equal Educational Opportunity Policy, and like the previous several, this is simply bringing the non-discrimination language in line with the state's non-discrimination policy, and this is a second reading.
Motion to approve equal educational opportunity policy JB for second reading.
Motion by Mrs. Fraley. Is there a second? Mr. Farrell. All those in favor? Motion passes unanimously. Thank you. At this time, we will move into the hearing of constituents. We ask that comments be limited to a maximum of 5 minutes per individual. A reminder that topics excluded are individual personnel issues, comments identifying individual students or staff members, matters that are on appeal or may be appealed, topics for which the board schedules formal public hearings, advertising or solicitation for products and/or services. And I will call you up to speak at the podium in the order that you're signed up. Is Miss Lori Lepley present? Sadie Fisher. Okay, thank you. Presley Mines. Doreen Haggerty. Not here. Jason Haggerty. Okay.
Concerned parent. I have 2 kids that go to school in this county, and I am concerned about my kid wearing a mask for 8 hours a day. And it might sound like I'm furious. It's because I am. I am furious. My kid shouldn't have to wear a mask for 8 hours a day, breathing in dirt, grime, and sweat. They shouldn't have to do that. I should have that decision on whether they want to wear a mask, just like everybody here. Honestly, it infuriates me that there's not more parents here voicing either. I don't care what side they're on. If they want their kid to wear a mask, I'm for that. That's their choice. If they don't want their kid to wear a mask, I'm for that. That's their choice. I'm thankful for that Ms. Fraley brought up virtual learning for the high school kids, because that's my main concern, choice. If they go to school, they're being told they have to wear a mask, and if my kid says they can't breathe and they take their mask down, I'm getting a call. I got a call at work this week, and I told the gentleman that I talked to that if my kid says he can't breathe, then he will pull the mask down. My daughter, if she can't breathe, she will pull the mask down anytime, and I will take that call every day, whether it be at work. I will not handle it correctly, I'm sure, because I'm, like I said, I get very, very worked up about it, because it upsets me that other people are making choices for my kids that absolutely is none of their business. I don't need the government in my life. I need, my kids need me in their life. That's it. But again, all I want is a choice. If my kids got to go to school, which I want them in school, I want them around other kids. I want them to be able to show their smile and laugh and joke around with their friends. If they go and hang out with their friends, that's what I want. But at the same time, I will not tolerate them wearing a mask for 8 hours a day. I will not. So if that's what the option is, then the option shouldn't be, well, if you don't like it, then homeschool your kid. It should be, we will offer another option, or it will be recommended, not mandatory. And I think that's all that I got. Thank you.
Thank you, Mr. Haggerty. That is the only other person we have signed up to speak. Are there any board member responses to constituents? Thank you. Moving on to new business, there's a school calendar adjustment. Mr. Blank?
Yes, the school calendar committee, it was an oversight, as you can imagine, everything that's going on. The grades are, the last day of the semester is Thursday, October 28th. So Friday, October 29th, we're recommending a 3-hour early dismissal for students with the afternoon set aside for teacher work time in order to put grades in. That's typically what we do every year at the end of the semester. So it was just unintentionally left off the school calendar, and we want to because the board votes on our calendar, we want to make this adjustment so that school staff and parents can be notified as soon as possible.
Motion to approve the school calendar adjustment for Friday, October 29th, as described by Mr. Blank.
Is there a second? Second by Ms. Frank. All those in favor? Motion passes unanimously. Thank you. So at this time, then, we will go back to discussion for a secondary virtual option. Ms. Fraley, did you want to start, or do you want Mr. Blank to speak?
I'll go ahead and start. Just, I think I clarified it in the original motion, but the discussion is that of choice, as much as the gentleman said. I think that based on the numbers that we see today and the trajectory of those numbers right now, that there needs to be some option for parents that are uncomfortable in sending their child to school, whether it be masks as the uncomfortableness or even just the amount of cases in our county being uncomfortable. Some may not be aware that the State Board of Education did get a resolution passed today by the Senate and House Committee, AELR, I don't remember what it stands for, that did pass that regulation, it's not a resolution, that regulation to require masks inside school buildings across the state. And so therefore, that being said, that's something that we, as overcomes our decision, but our decision was made and was in place for us to review on October 1st, starting after October 1st. And I think now, that would be overcome by that. But I do think we still need to reevaluate, and I'm asking for that reevaluation now instead of waiting till October 1st to provide options for all grade levels. And it sounds like I wasn't aware that the elementary was still not full. I think that if we could have a policy or a release that explains the process, if your child is in elementary, how do you go about doing that? Do you contact the school? You contact the school board? Fill out a piece of paper, whatever that process may be for elementary, because I wasn't aware of that. And then the discussion, Mr. Blank provided information about tutoring, and he did say contact the school if you have any concerns. That I wasn't aware of the process, but it's not, they're still just now developing it, right? Like it just came out, or is it not out yet? Whichever way that is, whatever that process is, be clearly communicated on what that process is so that students are aware, parents are aware, because I believe that, again, based on my experience that I have with my own child and some of his friends, is that they don't know what to do. They're doing their homework at 8 o'clock at night, and they don't know what to do, right? So they don't have a way to get that tutoring or the next day. And the other part of my discussion that I'd like to have is those that are quarantined, they are getting excused absences, but after, I believe the policy's 12, but I'm not 100% sure. After so many excused absences, there's an issue that gets reported to the state. So I don't know if those excused absences for quarantine purposes can be adjusted in some way to be be designated as a different type of absence so that those students that are unfortunately quarantined through no fault of their own are being punished because they have more than, could have more than those 12 or whatever the number is of absences. So.
Do you want to speak as far as the quarantine and the absences, Mr. Blank? Or-
Sure. An unexcused absence, and that does not follow the trail of truancy. I'm sorry, excused absences do not. So we're actually, what are we putting, nil Q? So that we know who's out due to quarantine. It's no fault of the student. So it's an excused absence as we move forward.
Does that impact their attendance at all? Because we've all gotten messages from parents.
I don't have an answer to that yet. I got that question also.
Yep.
I want to make sure we're permitted to. So however MSD will allow us, so that's a question that we don't have an answer to yet. Especially if we're giving packets and they're doing work. My argument is that's what we did all year last year when they were virtual and it counted, but I don't have the final say on that. I will ask for direction from the state on that. That's why we're tracking the cues so that when we get to that, we have that information already captured.
I would just like to add, and this is just a brainstorming session, you know, folks, we wanted you to see us do this live. We've not had this conversation before, but I'm hearing people like you, but I'm also hearing people that are just fearful. The numbers are so high, and so their secondary students are staying home. The problem with the packets, they're not typically physical packets then, they tend to be an assignment on Schoology. Many of them feel unprepared to be able to tackle those assignments. Unlike when we were doing, and believe me, in a million years, I would never recommend concurrent teaching, in a million years. You know, we did the best that we could. I had to do it at the college level. That is a challenge that nobody should have to live through again. But I'm wondering, even if teachers could film themselves or hit the button and film their lecture, their class that day, that students could view at some time at their leisure, that would help them to at least review the content. You know, there's no exchange because they're going to be watching it not live. But I think that would go a long way to help with, I don't know how old your children are, but that would go a long way to help with the secondary level, and particularly these kids who are quarantining 10 days or 20 days, or have decided for the next 4 months, they're just too afraid of the numbers in the county to send their 8th grader to school. So I'm wondering, is that a possibility, or could we put that on the table to discuss? Or ask you to discuss that with Dr. Caldwell and see if that's a possibility, if other counties are doing that, whether that would be an issue with ACEA. But I think that would go a long way to help a lot of these students. You know, a 10-day quarantine is pretty significant, especially if you're in some of the upper level or advanced classes, and to not have a framework and have nothing other than an assignment. I don't think we're giving our students the best education during this time. So that's just something I wanted to have on the burner somewhere to talk about, because I can tell you, I'm happy to hear that there are openings of the elementary virtual school that will make a lot of parents feel better that have reached out to me. But I will tell you that the majority of people who've reached out to me in the last month, as school started, were secondary parents and some students, actually. You know, 10th grade, 11th grade students. So I think we didn't anticipate that, given the survey numbers were so small back in July, but things have changed. And I think this board needs to be a little more proactive, and this system needs to be more proactive, and somehow figure out a way, if this continues to get worse or even stays at this level, how do we manage to give those students an effective education? That's my only contribution. This is something to think about.
Yeah, obviously, we've had those discussions, and we were trying to figure out the best way to meet the needs of our students. But you're also on a slippery slope. Our direction from the board was we wanted as much face-to-face instruction as possible, period. We don't want any more of this or any more of that. So that's why we're with the tutoring during the 10-day quarantine, 6 days of missed class, trying to see what kind of effect that has. At the same time, looking at things like you had suggested, But we will need to have some multiple conversations, because it's not just, hey, this is what we're going to do, and bang, it happens. This organization is much bigger than that, and every decision made, as you know, it's going to take a little bit of time and give and take throughout that process. But I will say, if we're going to, I will refer to last year. No one worked harder than our staff to get our students back. We were, in the state of Maryland, there were 4 counties that went back 5 days a week for the fourth 9 weeks. We were one of them. Nowhere else was that. Some were doing 4 and some never. Of the over 800,000 students in the state of Maryland in public schools, over 500,000 students saw 0 instruction. That's not Allegany County. We were doing everything. That's a compliment to everyone, you all sitting here with your direction and everything that we've been doing. But here's my point. When we got to that fourth 9 weeks, when it was an option to just whatever you want to do, we had 25% of our high school students not return when it was safe to return. I think that's an injustice if we do that for Allegany County, for our students. And I know that right now our times are, the numbers are a little different, a lot different in some cases. I'm not denying that. I'm just saying, when you put whatever staff, whenever we try to put things together, there's got to be a mechanism that we were pulling that back, saying students will now return or they won't, because we found that out last time. So there has to be that piece built in to what you're saying. It's going to take some time to work on that. So
I'd like to make a suggestion that, much like we did in the years past when the numbers were so high, and we came up with the decision to have hybrid / all virtual / back to 5 days a week. When we were back to 5 days a week, our number was in that 5 to 15 range, right? We had that metric at that time, and we were using that metric, and we were not using that metric now because we have vaccines and there's a different metric per se. But we are in the red and orange, right? But we're in the red right now, but there's orange and red. And honestly, when you look at across the United States, I looked at it earlier before I came here, there's one state that's orange, which is California, and every other state is red. So we have to think outside of the box and think about what we can do, because our numbers are heading in that direction again. And we can't be naive to say, well, they'll just go back down. We have to consider something and give parents and students a choice, and a choice based on a metric. I've said all along that we needed a metric. I asked the question of Janelle at the meeting if we could have a metric when we were looking at this to go back on October 1st. And the metric was to use the CDC guidelines, right? So we can use that. And we're in the red, so we need to come up with other options. We can't continuing in the process as if we're in green when we're in red. So I'd like to have, and this came up under new business, so I would assume that at the next board meeting it would go up under old business. But I don't know, maybe this is discussion. So maybe I'd like to make a motion to have this added to the agenda for the next board meeting to include the discussion that we had and any action that can be taken under old business.
So are we adding more discussion, or like, in the meantime, are we asking Mr. Blank to just come up with solutions of what the system is capable of? Or?
So what I'm asking for is him for the board to direct Mr. Blank to look at options and solutions to provide options for secondary schools, school students, and have that information for us as a board to make a decision on those recommendations at the next board meeting. I need a second, I think, because I made a motion.
Is there a second to Ms. Fraley's motion?
I'll second that.
Ms. Frank? Any discussion?
Yeah, I have questions. Are there parameters? Because if we're talking about virtual, are you talking about concurrent? I mean, we've stood on our head to do everything we could do last year, and when you're talking about secondary classrooms, I have the head of HR here. When you're talking about secondary, I don't have people who are certified in all the secondary subjects, let alone extra math. We're trying to fill, we have them filled, correct, Mr. Wilson? But we don't have any, it's not like I can go to a sub list and say, okay, for a virtual school, these are the things we can do. So I'm just asking, I'm not saying we're not going to look at it. I just want to know, is concurrent on your list as an option? Is virtual on your list as an option? Because I don't want to spend, if they're not, then I don't know what we'll do right now, but we'll see what we can come up with. But I want some guidelines so we're not thinking we're on the right track and not on the wrong track.
So as has been said in the past, I'm asking the superintendent yourself to give us what the options are, because that is your wheelhouse and not ours. So whatever would work to allow an option to have the secondary school students who cannot come to school for whatever reason, whether it's a parent choice or not a parent's choice and because they're quarantined, to have an option to have some type of learning capability that includes instruction and not just packets.
Okay, so that would encompass everything then, because last time the direction from this board was concurrent teaching, we need to, don't bring that up. So now you're telling me that that's whatever we can create, we bring back. Is that what you're asking? Okay.
Well, I would add to that we even try out some different things we didn't try out last year, like what I just suggested, asking teachers to videotape their classes, to make them available so students can watch them at least. Yes. And not be a live participant in the class. Because frankly, at that stage, if you're talking especially 10th, 11th, and 12th graders, I think that would be adequate to at least keep them on target with the content. That's way different than concurrent teaching, obviously.
Right.
So that was something we hadn't had on the table before. So I agree with Tammy. Anything you come up with, you can give us a list of 10 things and say, this is why these 7 of these 10 won't work. But these 3 might work.
Okay,
And I agree, that's not our expertise.
So there's two things then. Maybe I'm confused. You're asking me about the students who are quarantined. That's a whole different animal for us to try to figure out, because the kids are coming back. So what you're just saying, so are we talking about kids who are quarantined or kids who?
I'm predominantly talking about the numbers of secondary students and parents of secondary students I've heard from who are fearful of the numbers that keep coming out from the health department every week. Just keeps going up and up and up. I would beg people to get vaccinated. I just don't know what it's going to take in this community. We are stuck at the low 40%. So it doesn't look like that's going to change much. So now these parents are very panicked, as are the students, that, whoa, wait a minute, look at these numbers, and we don't have an option to stay home. I know that students are staying home because of that, counting them as an unexcused absence or whatever, and that I'm worried that's going to get worse and worse as the month or the next 2 months go on, that we're going to have an absentee rate of 40 or 50% from an entire school. And I think a way to at least keep those students on target would be to have or give them the opportunity to view some classes and lecture material and not just have blank assignment sheets posted on Schoology, which is what we're calling a packet. So I think there are some things that we can do and maybe it doesn't happen. Maybe in the next 2 weeks, so many people go out and get vaccinated that we don't really have this issue and we see a plummeting of those numbers. But I don't see it. It hasn't happened. And I think we've just got to be prepared. I'd rather have options like that in advance and in place of concurrent classroom teaching, which is very difficult for the teachers, it's difficult for the students. So is there something that we haven't tried? So that's what I'm asking. If there are things that you see other schools have tried that we haven't yet and might be an option for us, at least, as we start moving through this year and hopefully have better numbers in a short period of time. So that's what I'm asking.
Ms. Batman.
I speak for many students, staff, and teachers when I ask in this combined plea to please avoid concurrent learning as a last result. I think the stress on teachers was undermined and undervalued, and I'm grateful that it has now been recognized at this time as the stress on the students. Concurrent learning disadvantages both people in the classroom and people behind the screen. There's evidence, and ask any student ever, and they will tell you the same story. As we try to expand virtual options for the higher grades, I ask that you keep this in mind while we're compromising for a solution. And now I will concede that quarantine students have expressed that there is some difficulty keeping up with assignments, but those who I've talked to have also stated that when they reach out to a teacher, they are then able to provide the needed instruction on an individual basis through the messages function on Schoology or through other means. And I will tell you that many students are able to log into a specific portion of Schoology, like under their class, that is for quarantine students. And under that are specific instructions and videos. There, those regular assignments. And many teachers have started doing that separation, so maybe if we could encourage that. That's the feedback I've heard from students. Thank you.
I think we're hearing, I'm sure that Mr. Blank and his staff and the folks in the school system have tried to figure out the things that we need to do. I don't know that our staff, that our teachers, that the people in ACPS, to try to put them back into a virtual learning environment is, number one, feasible, but I think it's putting a lot on the staff right now, unless I hear something different that says it's not. But number two, in the county, we've seen all this stuff in the news, and we're getting so much money for virtual, whatever. Well, go to Flintstone, go to Old Town, go to down George's Creek, go to some of these places, and folks are not able to get the internet, so the kids can't have it. So there has to be, and I think they have done with the home and hospital and some of the things that Mr. Blank has outlined, that's working. But to expect our teachers and our staff to do virtual plus classroom, I think you're just asking a lot of the employees. So that's, I guess, my 2 cents.
So this is, I have never asked for them to do both. We've specifically, she said it this time and I've said it in the past, we're not asking for concurrent teaching. We're not asking for the teacher in the classroom to have to do additional work. What we're asking for is options to allow those students, if, I forget her name because she's new, the student member that, you said there are some teachers that are doing that, have a special section, have recordings, whether they're even YouTube, they're not necessarily that teacher, it's a YouTube link, anything to provide these students an option to be able to be taught. We're not asking for the teacher to concurrent teach, because that's, as she said, and I would say for myself too, no way. It didn't work for the student, it doesn't work for the teacher, it doesn't work for anybody, really. We tried it, we did what we had to do last year, but we found issues with it, so why would we do it again? But we need to look at other things, and that's all we're asking for, is options to be available. And it may be individualized by school, by teacher, by content area, right? Like it may be easier to do math one way and do science another way. We need to think outside the box, but we also need to ensure that across the entire school system, every school that has students has some option. If we're going to allow it to be customized by school, that's fine, because each school has different needs of their students, but we need to ensure that every school has some type of option. That's what we're asking for in this motion to be discussed at the next board meeting, is to have options available. And like Deb said, if it's 10 options and only 2 of them will actually work, just bring us the 2 that would work, that you think could work. No one's going to ask that it be 100% accurate. None of us know exactly how to solve this. If we did, we wouldn't have the problem. So let's just look at some options and consider them again at the next board meeting, which is a long time away, unfortunately, right? We only meet once a month. So it's something that would be, the second week of October before we have the discussion. And maybe the discussion comes up and all of our numbers are better and we just say, okay, never mind, which is unfortunate because we're asking the staff to do something, come up with ideas that may not need to be needed. But we need to be proactive. If we just wait till it happens, then we're caught with our pants down, as some people say.
As I said, our staff right now, I can guarantee you, knowing Mr. Blank, that he's already working on those ideas in his head. Somewhere, he's got folks working to try to come up with better ways for this system to operate. But to put that burden on them right now and say, we want you to do that, I hate to do that to him. It's not that I don't want to do that. If there's a way to help the students, then absolutely, let's do it. But why do we have to? I think he's pretty much told us this evening that he is already working on that stuff and that we are looking at it. So I think that he will do that without us mandating it. I don't like that mandating idea at all, but, and I'm still a little bit not very happy with the state board over their decision today. They're not elected by anybody, they're appointed, and the local boards are elected, and we know what goes on in our county. That's my opinion, that is my opinion, and I'm sorry to voice it here, but that's the way I feel about it. But I know Mr. Blank, and I know that he'll do these things without us having to say, we're going to put it on the agenda and do that. But whatever it takes to help the students, I'm all about it.
And I have to say that I'm a little offended that you're taking this as some sort of attack of Mr. Blank. And I know, Mr. Blank, you know that that's not what I'm doing. I feel very strongly that we need to be ready because these numbers are not getting better. Every time we get with Janelle and Dr. Corder, the numbers are creeping up. They just keep creeping up, and I'm getting more pushback from parents. It's not that I believe Mr. Blank is shirking his responsibility, not at all. But the role of this board is to collectively assist, develop policies, those kinds of things, and it's not to run the school system. If he believes that he has done everything he can to reach these secondary students who are staying home, then I'll take him at his word. But we lived too long last year in the land of not knowing what was around the corner and having to stop and start over and over again, as did the world, but we were hybrid and then we weren't, just crazy stuff. But I think we are hearing from too many people who are very concerned about the numbers. And I'll take this as my personal stance, not the board's. Darn it, people, get vaccinated. I cannot have this fight anymore with people. I surround myself with medical professionals. I was a pre-med student. I ended up with medical dietetics. I read scientific journals for fun. I know these work. They're not perfect. I know vaccines work. That's not perfect either. But we're going to sit here and have this conversation every single time we get together with students who are frustrated, with teachers who are frustrated. God bless our school system personnel with a 75% vaccination rate. That's spectacular. But when we're living in a county with 42% vaccinated and the 12 to 17-year-olds, what's that, 30-something? We're stuck in this land. And somebody like you who doesn't want your child to wear those, and I get it, that's your personal belief, you need to have an option to educate your child. And just having a page on Schoology to fill out, and Genevieve pointed it out, some teachers are really proactive with that and planning for the students that are quarantining and the students who are staying home. But I think we need to have a system-wide approach and a proactive approach to have that in place. So it was nothing at all attacking Mr. Blank. It's not dumping extra work on him. If they've discussed this already, then he can get together with Dr. Kaba and tell us next week, this is why we looked at this, and or the next meeting, this is why we threw that out, and that's why this won't work. I need to hear it because I don't know what will work and what won't work. So it's certainly not an attack on Mr. Blank. And I am bothered every time that we have a discussion about things that there's an inference from some people at this table that we're attacking somebody. My role here, and I was elected to do this, make the best decisions possible for the citizens in this county, and particularly the students. That's what I'm doing. So I need to have the conversation here. It should be out in public anyway.
So there is a motion on the floor with a second, and to recap, the motion is for Mr. Blank, without parameters, just in general for Mr. Blank to bring back to us what options there are, whether it's virtual or quarantine students, and how we can better their education while they're not in the classroom. Correct, Mrs. Fraley? Yes. Okay. All those in favor? Opposed? Motion passes 3-2. Thank you. At this time, I need a motion to meet in executive session on October 12th, 2021. Ms. Frank, is there a second? Second. Second by Ms. Fraley. All those in favor? Motion passes unanimously. Reports of special or advisory committees. Ms. Batman, do you have anything else you would like to share?
So as you know, Brooklyn was not able to attend today due to an athletic commitment, but she would like to report that there are no significant updates to provide to the board as schools are still formulating and creating and electing those student council boards, which will be the main source of information. And she will have more insights once respective student councils have been established. Now, as for topics that were brought up today, I would like to take the time to speak for the general student body in favor of physical learning and deliver our heartfelt gratitude to this board and all of its employees in facilitating our return back to in-person learning. It's been quite the adjustment, but most of us are grateful to be back in the school buildings. While I'm not an expert, as a student, I can assure you that test scores and grades will be higher and class failure rates will be lower as we have this opportunity to be back in class and, more importantly, have access to school-related functions, extracurricular activities, sports, band, everything that, for some students is why they come to school. And to speak for the students who would rather be in a virtual setting, we understand how logistically hard it is to create a separate space for a virtual learning environment, and we are grateful that you understand and recognize our concerns, and hope we can reach a conclusion so that all students feel safe and are comfortable in their learning environment. Thank you.
Thank you. Are there any board member updates? Ms. Fraley?
Have one update is that the Maryland Association of Boards of Education is having their annual conference in October. It's an opportunity to learn from all the other counties in the state of Maryland on processes and procedures that they're following, as well as just learning from each other. They're requiring masks in that conference. And it's the first week of October, so it would be prior to our meeting, so that would be helpful for anybody that's attending. And the only other thing, too, is the AELR committee that's done by the Maryland Senate and House are elected officials. They're the ones that made that decision today, not the state board. The state board brought it to them, but they made the decision in a vote of 10-7. I just want that to be clear so that it's not misinterpreted of who made that decision today. Thank you.
Are there any other updates?
I wasn't saying that. My understanding of today was the state approached these senators for that to get approval to do that, and that's what was done. What I'm saying is we are local elected officials of the school board of Allegany County. The decisions on what goes on in each individual county should be by those people that are elected by the people of that county. The State Board of Education is an appointed school board. They're not elected by anybody. And I don't think that they should be mandating things like that to the county without due consideration of what goes on in those counties. Our numbers could be very low. We could drop off the face of the earth, and 2 weeks from now, I wish it were, Mr. Mayor, that we would be not have a problem with this. but in Montgomery County or Prince George's County could be escalating. I just think local control is better than somebody who is appointed by the governor to serve on the state board. And that's my opinion.
So again, just to clarify, the state board did, which is appointed, did bring the regulation to a vote, and they voted on it, but it had to go through by checks and balances of our government, had to go to the AELR committee, which is made up of senators and delegates of all counties. It was 10-7, so there's 17 people there, had senators from every county represented. Our representative was there too, from Allegany County. So it's just an information to let people understand that that's what that process was, because it's not well known what that process is, and they went through that. And that's what we get for living in a democracy. That's the decision that was made. But that decision being made only impacted 2 counties, because every other county in the state of Maryland had already made the decision to require masks in their school buildings. So it only affected 2 counties, but it's being propagated as the state made this decision. Honestly, in this case, 22 counties made the decision on their own. And they're being, what's the right word? The state is actually agreeing with those counties' decision. They're not making them go backwards. They didn't say, no, you made the wrong decision. They actually are telling the 22 counties that they made the right decision. And now they're just asking for the other 2 counties. And it should be very clear, because it was in this testimony that was 4 hours today, that they will be reviewing it every month. It's not to exceed 180 days. It wasn't 180 days, period. It's not to exceed 180 days, which means they could change their mind next month at their board meeting if the numbers are different. They can come back also, because Clarence Crawford, which is the president of the state board, said he could decide, you know what, let's look at it by county. And they could say, Allegany, you come up with a metric, a true metric, and be able to utilize it. So the state board has made a decision, but it's not superseding our decision that we made previously. So in this case right now, we were already made that decision, and it needs to be just clear that it was not the state board themselves. They did make the resolution, regulation, but they did ask, it was required by the governor. The governor required them to have this 10-day waiting period and a public hearing, and that was done today. And testimony was given by both sides, pros and cons, and those senators and delegates made the decision today.
Is there a motion to adjourn? So moved. Mr. Farrell, a second? Ms. Fraley, all those in favor? Motion passes, yes, unanimously. Thank you. Have a good night.